Hi, this is Chapter 13, Managing Patient Care. There are entry-level competencies, and the National Council of State Board of Nursing identified competencies that particularly registered nurses and licensed practical vocational nurses, which are LPNs, need on entry to practice. Three of these are: you need to demonstrate nursing knowledge and display confidence in knowledge base. You need to demonstrate knowledge of roles, responsibilities, and functions of a nurse, and recognize your own limitations and see supportive validation of decisions as needed. So, all of these things basically have a lot of critical thinking involved. Uh, Regardless of whatever type of setting in which you eventually choose to work as a nurse, you are responsible for practicing whatever professional standards of care and using uh, the organization that you are working with resources and participating in organizational routines. You are also responsible to collaborate people with people and individuals so that you can provide appropriate care. So, what you do when you're talking about building what you consider a nursing team, your education and the commitment you make to practice within whatever standards that institution or guidelines that they hold is, it can be really rewarding for your career. It's also very important to work as a member of a cohesive and strong nursing team that values um, mentoring and respect for teamwork and integrity. So, an empowering work environment brings out the best if it's a person that is to work, as well as an excellent nurse manager and nursing staff. They share a philosophy of care that includes a nursing care delivery model and management structure that, basically supports the professional nursing practice. So, a strong nursing team, an empowering environment, an excellent nursing manager, and nursing staff is what you really requires to build a good nursing team. You also have magnet recognition. Magnet recognition is really a wonderful way to basically for hospitals who have a clinical promotion systems and research and evidence-based practice. Like for instance, Tampa General Hospital is magnet recognized, and I remember when they were even going through their magnet designation. And it's good when you have or a facility has those certain uh, um, designations, because what it's saying is that they promote professional autonomy. Um, they respect the nurse's role in it, and they give them a certain amount of control over their practice environment. And as a professional, that is very important to you. A magnet hospital empowers the nursing team to make changes and to be like innovative and create things, ways of practice that's best for patient quality of care and outcomes. So when you work together with your team members and everything, you get a good source of stronger outcomes. So you got Jennifer, a nursing student who is assigned the following three patients: Mrs. Sinclair, who is scheduled for surgery to repair a fractured right hip; Mr. Timmons, who has finished lunch and is ready for pain medication; and Mr. Dotson, who is a post-operative wound infection and is due for antibiotic medication. Okay, so keep that in mind. She got those three patients because has a lot to do with how you handle nursing and whatnot. Goal. So you have nursing care delivery models. The goal of the delivery model is to help nurses achieve whatever outcomes that are desirable for their patients. Common components of a nursing care delivery model is, of course, the nurse-patient relationship, your ability to clinically decision make, and patient assignments and work allocations, um, communicating with your interdisciplinary team, such as your physician, if there's a physical therapist involved, if there's a social worker involved, and management of the environment in which that care is being delivered. So, within that model, uh, you have various types of nursing care delivery models. You have what they call, and these is ways that they structure within the unit for you to administer care for your patient as efficiently as you possibly can. You can start with team nursing, total patient care, primary nursing care, and case management. Of those delivery models, I want you guys to be able to recognize the difference between those particular delivery models. And so I'm going to describe these, and I really truly want you to be aware of what they are. First, you have what they call team nursing. Team nursing is described as a collaborative care style that encourages each member of a team to work with and help the other members. There's a hierarchical communication from the charge nurse to charge nurse to charge leader, and team leader to team members. Okay, and the decision making occurs at the clinical level. So, how can I describe what a team nursing is? When you have a team nursing approach, it basically you have a registered nurse and she leads the team. And the team members are provide direct patient care under supervision of the RN. So you may have a RN, a practical nurse, and any unlicensed personnel like techs or aides or whoever. Okay. And based on the type of things that they can do, they will be responsible for that whole tent. The RN is the main person that's responsible, but based on what they can do, their assignment will focus on that whole team. I've done this type of nursing before, and it's very difficult. Um, what it is, and you see it a lot more back in the day, like in the late 80s when I started, and in the 90s and that type of thing, where you would have the RN, the LPN, and then you would have the technician. And what you would do is, like, you might take one whole side of a hall, and that hall would be like, let's say it's 10 patients on that hall. Well, what it would happen there is the um, basically the RN would make all the clinical decisions. And she would make the clinical decision, be responsible for initiating physician orders, administering medications, um, taking off doctor's orders, and directing the other members of that team. Then you would have like maybe the LPN. The LPN would be responsible for doing whatever activities or whatever things that they're responsible based on what their competency level is. And then you would have like maybe the technicians who may be just responsible for bathing and grooming and cleaning patients. Okay, so it's good, but the team leader has a high level of autonomy. Uh, the patient care coordinator has time to manage the unit issues. Uh, and but the disadvantages to it is that the team leader spends don't spend as much time with the individual's patients. It takes time for the team leader to delegate work. And so it's not as effective if the team leader, maybe they got poor leadership skills. And it can be a lot of work when, uh, uh, like, if the team leader decides, well, I'm too good to give a bath or help the technician. They could have, like I say, 10 patients that they're responsible for grooming and answering call lights and doing this and doing that. So that's what you have when you have team nursing. Total patient care. Total patient nurse care, the registered nurse works directly with the patient, the family, and the healthcare team member. So with total patient care, the RN is responsible for patients during the shift of care, although care can be delegated to some. But you're responsible for everything. You're responsible for grooming them, giving them a bath, giving them their medicines, taking off orders. Now, you may not have that many patients. You might have 3 or 4 patients, but it depends. You might have a really high acuity of patients. So if the charge nurse assigns you 2 patients that are very, very, very rough, and then you got somebody else that is assigned 2 patients, and let's say or 3 patients, and there's patients are up ambulatory, there can definitely be uh, the workload can be more difficult on one person based on the other person if the charge nurse don't take in mind the acuity level, or which means basically how difficult the care of that patient is when making those assignments. So that's and the patient satisfaction is high, but a lot of times that's a good thing because they're used to seeing their particular nurse come in there and they're responsible for a lot of things. But if you don't have support people that are helping you get every single thing done, or if they are not taking some of the responsibility off of you, it can be very, very difficult when you do total primary nursing is when one primary registered nurse assumes responsibility for a caseload of patients. So, what's different from that is that, for instance, primary nursing, you got a nurse, and this nurse, the length of time that that patient is in the facility, that nurse will always have that particular patient as their patient when they come and work, and they will assume primary responsibility and know what's going on with those particular patients totally. So you communicate laterally. You communicate with the nurses taking care of the patients, and you telling them what's going on with that particular patient. And it can be very flexible, and it could be a lot of variety of staffing levels and mixes involved in that. But you will know that I'm the primary nurse for this particular patient, and I'm kind of like running the show. Even when I'm at home, this is still my primary patient, and I know when I come back, I'm going to have that patient, and I'm going to see what's going on with that patient. The RN works with a limited number of patients as well, so that can be kind of satisfying. And then you have what they call case management. Most floors have a case manager. And what the case manager's responsibility is basically is managing and overseeing and facilitating and advocating for a particular patient's individual needs. They'll have a lot of contact with insurance companies, a lot of contact with interdisciplinary people like physical therapists. They'll have contact with home health companies, different, various different people, and their role when they're a case manager, they can have a particular floor. Like they might be the case manager for the cardiac unit. And what they're doing is they're uh, responsible when a patient has a lot of complex health problems going on, of getting those needs met. That doesn't mean that they might not have a primary nurse, you know, but they're responsible because what they're trying to do is they're trying to help with discharge planning. The case manager is, and they're keeping in uh, uh, their mind cost effective ways to do it, as well as trying to get it done efficiently and by collaborating with different people and trying to get the patient's needs met. So what you need to do is you really need to be aware of those various type of nursing care models or care delivery models. You need to be able to identify what's the difference. Okay, so a quiz. A travel nurse has taken an assignment at a healthcare facility where the nurse assumed responsibility for a caseload of patients over a period of time. This type of nursing exemplifies what? It's not team nursing. Is it functional nursing? No. Is it decentralized management? No, we didn't talk about that. What that is that's primary nursing where you assume responsibility and you have a caseload of patients and it'll be a low amount. Okay, so decision making. You have what they call decentralized management, and it means that the decision making occurs at the level of the staff. So you have committees and all of that type of thing. And what's really good about decentralized management as opposed to centralized, where the top is just telling everybody what to do. Know those that terminology, the difference between decentralized and centralized, because centralized is from the top going down to the staff. Decentralized is where the ideas and everything come from the staff and it goes up to management. But a good thing about decentralized nursing is the responsibility and the autonomy, the authority, and the accountability. So you're accountable, you're answerable for your action. The authority makes it where basically you are giving commands and making final decisions. And then autonomy means that you have a certain amount of independence as far as decisions about patient care. And then responsibility means that you know those, and as a professional, you're making those correct responsibilities. So it's important for when you're developing or you building or managing patient care or a team is to have staff involvement. You want establishment of nursing practice or problem solving committees. So you'll have all different types of committees for this, committees for that, and they'll meet maybe once a month or they'll meet, and have meetings. You want interprofessional collaboration, which means that you may have, and this is really seen really big in like rehab type facilities and facilities where You have people who have catastrophic illnesses because they're going to be there for a while. So you may meet once a week and everybody's putting in their input and trying to come up with some type of care plan to establish to best meet that particular patient's need. Interprofessional rounding, which means that everybody goes around and they discuss that particular patient and what they can do. And it facilitates staff communication as well as staff education as far as everybody's role in assessing and assisting that patient in that care. So it's very, very important for your leadership skills for nursing students to be developed, and these leadership skills will include um, clinical care coordination, communication, which communication is one of our nursing pillars. It's a very important thing. Delegation, your ability to delegate or to instruct people on the correct things to do, and you're continuously building your knowledge base and learning as you practice. So those are very important. And when you're coordinating your clinical care, you know you have to make clinical decisions. You know you have to set priorities. Priorities are very important because you got to weigh and measure what is the most important thing to facilitate wellness for me to do the quickest to get something done uh, that is going to provide this patient with a level of care where we can be most successful. You have to have organizational skills. You have to be able to, as they say, walk and chew gum at the same time. Always know that there's always resources, and as a professional nurse you have to use those resources. You don't know everything. You're always constantly, all of us, I don't care if you've been in the game 30 years, you are always learning, developing, and knowledge seeking. And that is one of the key things about being a nurse. You don't want to be a know-it-all. You always want to use your resources to make sure you're doing things correctly. Time management is important. And then, of course, the ability to evaluate if the care you provided or the things that you are doing is successful uh, at all. So you need to make those clinical decisions. You're going to conduct a focused patient assessment based on what the patient came in there for. You're going to ask what outcomes the patient expects in his or her care. You're going to make accurate clinical decisions based on the data that you gather, and you're going to be thorough. And then you're going to always ask for assistance when needed. Okay? So, very important things is always to include the patients in your decision making. Because, like I said, it's nothing worse than to have a patient that has different expectations of what the outcome should be. So, and a lot of times you may have to go over that several times because a lot of times when a person is going through a medical crisis or something, they may not necessarily hear you the first time. You get what I'm saying? So you have to, because sometimes they're just overwhelmed with the information that they're getting. And then you have to make sure when you communicate that you're communicating on their level and you're not speaking over their head. Priority setting, like I said, you're going to determine whether a person is a high priority. A high priority is if they have an immediate threat to patient survival. Immediate threat. Intermediate priority means it's not emergent or it's non-life threatening, but it's something that definitely has to get done. And then a low priority is actual or potential problems. Okay. So when you're triaging patients or you're deciding what to do first, you should always look at high, intermediate, or low. Okay. Low being what could possibly happen, high being this is an immediate threat. Okay. And intermediate is in between. So, Miss Sinclair surgery is scheduled for 1. She has never had surgery before and is very nervous and moving restlessly in bed. She is reluctant to talk, but her preoperative checklist is not yet completed, and she needs to be escorted to surgery in 30 minutes. Mr. Timmons had an abdominal surgery 2 days ago for colon tumor removal. He has finished his lunch and is prepared and is ready for pain medication. He's prepared to get out of the bed to walk down the hall. Okay. Then you have Mr. Dotson, and he has a post-operative wound infection. His wet to dry abdominal dressing needs to be changed, and he needs his next dose of the antibiotic. So Jennifer stays with Mrs. Sinclair to assess her new symptoms and complete her pre-operative checklist. She sends a unit clerk to check on Mr. Timmons. Once Mrs. Sinclair's checklist is completed, she stops by Mr. Timmons' room to assess his pain and administer his medication. Then she verifies Mr. Dodson's identification and administers the antibiotic and next completes the dressing change. Do you see how her doing what she did was the right way to get it done? Because first of all, Miss Sinclair has never needed that preoperative checklist. She was due to go in 30 minutes. Uh, then Mr. Sinclair uh needed his pain medicine. But at the same time, she sent a clerk to just make sure that Mr. Timmons could hold on. And then lastly, she did the dressing change on the person, administered his antibiotic. So, organizational skills, you need to prepare your location, prepare equipment and supplies, prepare patient, make sure the patient is comfortable, positioned, and informed. And you request assistance if needed. A lot of that was done when you was coming in doing health assessment and you was like, I'm doing this, I'm preparing this, I'm gathering my supplies, I'm doing that. That's all part of the organization. So you really need to think about it like that. Okay. So you work cooperatively with staff members, you help other staff members as needed, and then you ask for help when needed. And you always recognize if you don't feel comfortable with doing something or you haven't been uh let's say exposed to something, always ask for help. And the next time it'll be so much better when the situation comes up. I would rather someone ask for help and get that help and be thought of, well, she didn't really know how to do that, than her just try to go ahead and do something on her own and then make a error, or just not being knowledgeable about something and jeopardize the patient. So always ask help. Time management, you need to remain goal oriented, you need to focus on patient priorities. The patient is first, you guys. You need to complete your activities with one patient before going to the other. You can't have 4 and 5 things going on at the same time, and you don't want to make the patient feel very uncomfortable with that particular situation. Time manager strategies to do is sometimes people create a to-do list. Maintain work area readiness, make sure it's organized. You need to create sometimes a time log. You might be like, I need to give my 8 o'clock and 9 o'clock medicine. I have between 7:30 and 9 o'clock to do this. I have this between this time to do this. So I won't. Uh, Always practice delegation. There's nothing wrong if you have somebody working with you that's a paraprofessional. It's okay to say, Sally, I need you to assist me to go and take Miss such and such her tray in there. I need you to help do this while I go do this. And I'll meet you back here later. It's nothing wrong with that. And then limit whatever task interruptions you are doing. Like I say, when you get in there, you may only spend 5 minutes in the patient room, but when you get in there, it is your job as a nurse to make them feel like you're giving them all the time in the world and that they are the primary focus. And I don't want you to just make them feel like you're giving them all the time in the world, but I want them to be the main focus. No, nothing going off in the midst of what you're trying to do. And your focus should be strictly on them. I have had physicians come to see me, and at the end, when they leave, I look at my watch and say, my God, they was only in here 6 minutes. But when they're in there, they make you feel because they've met as many and all of your needs that they was in there talking to you for 30 minutes to an hour. So that's one of the real good skills that you need to practice as a nurse. And then you need to evaluate. Evaluation is ongoing. You're going to find out about when you are administering medicines. Like if you administer pain medicine, you're constantly going back, evaluating. How are you evaluating? You evaluating by, oh, I administered a pain medicine 15 minutes ago, an injection. Let me go in here and check quickly on Mr. Uh, Robinson and see if it kicked in or started. You told me that you was a 8 when I gave it a few minutes ago on a scale of 0 to 10. What are you now? So that lets them know that you're concerned. And these things are things that take time to build up on when you are in the middle of your practice, but at the same time, um, they are things that make your life easier because when a person knows that you are concerned, they don't tend to bother you as much because you are able to determine beforehand, sometimes before things happen, that they need to be done. Like if you know that you gave somebody that has been in severe pain, uh, pain medicine 4 hours ago, and you know that they can get it every 4 hours, it's okay for you to go in there 4 hours later and say, Mr. Such and Such, is it okay? Do you need any more pain medicine in a little bit or whatever? And they may say, well, no, I'm good. Or they may say, well, yeah, I'm starting to get a little, pain level. And then you tell them, okay, well, I'll be back in 15 minutes to give that to you or whatever. So it's okay for you to do that. So when Jennifer assesses Mr. Timmons' pain, she discovered that his pain is an 8 out of 10, following Percodan 20 milligram every 66 hours. Patient control analgesia with morphine was removed 4 hours ago. Okay, she determines that his current pain medication is insufficient to control his pain and requests a change in his medication. So, team communication, you use structured communication techniques like briefings and group rounds, and you give report. You do SBAR. Remember we did when we practiced that SBAR type charting where everybody can read and see what's going on. You set shared expectations. Always treat your colleagues with respect. You will be surprised when you treat your colleagues with respect, and you will be surprised at just what they're up against. And a lot of times they'll be surprised at what you're up against when you're working. Maintain professionalism in electronic communications. Okay, so which means the professionalism means you don't write how you feel like, oh, Mr. Such and such is being a butthole today, or whatever when you're doing your chart. You might put that he appears to be agitated by stating blah blah blah, or by whenever you make a statement about somebody, you need to give proof. uh he's agitated, he's shaking, he's using profanity to the staff, his blood pressure is up, he's diaphoretic. So always have, use right types of communication. So when you delegate, you always, one important thing about delegation, make sure that when you delegate a particular skill set to somebody, that it's appropriate for what that person can do. Make sure that you are aware of the people that you are working with, and that you get a knowledge base on what they can do, what they're comfortable with doing, and that type of thing prior to you delegating. Because you want to make sure that you have good outcomes, and you want to make sure that you're helping to deliver appropriate care. So, the 5 rights of delegation, I do want you guys to know you're going to delegate the right task. You're going to delegate it under the right circumstance, to the right person. You're going to give the right type of direction, and the right supervision. So do know the 5 rights of delegation. Steps to effective delegation is to assess the knowledge and skills, like I said, match the task to the assistant's skills, communicate clearly, tell them what the task is, tell them what you want the outcome to be, and tell them when to go do it. Don't leave it up in the air. Listen attentively if they are disputing something or telling you something, and provide feedback. So, a newly graduated nurse is assigned to a team consisting of herself and a certified nursing assistant. When delegating skills, she needs to do what? She got uh, she's a newly graduated nurse herself, and she has a CNA working with her. When delegating skills to her, she needs to do what? A. Assign only bed making and feeding. B. Assess the knowledge of the certified nurse assistant. C. Remind the staff member that she is working under the license of the RN. D. Allow the staff member to perform only skills that the RN is able to teach the certified nursing assistants to perform. Well, the answer is B. Assess the knowledge of the certified nursing assistant prior to you delegating. Okay, so questions? Of course not, because we're doing it over video. So you're going to improve patient care through innovation, complex testing, consultation, and broad menu. You're going to manage costs. You're going to build physician and patient loyalty. Okay, so that is the end of managing patient care, chapter 13.